of your favorite local musicians. Hello everyone, my name is Mick Hess, your host for Roving with the Arts here on KSJE 90.9. Please join me every weekday starting at 9 a.m. for the chance to hear full-length, unabridged opera, ballet, symphonic, and chamber music. I'll share news of local concert events that you may be interested in attending, background information about some of the greatest musical compositions ever written. Tune in weekdays 9 to 10 a.m. and Wednesday from 9 to 10:30.
Hi everyone, I'm Scott Michlin.
And I'm Megan Collop.
Inviting you to join us for our COVID-19 local information program Monday and Thursdays at 9 a.m. live on the KSJE Facebook page and YouTube channel.
Each episode we get to hear from local medical experts, community leaders, and more.
Join us every Monday and Thursday at 9 a.m. live on Facebook and YouTube, and every afternoon at 5:06 on KSJE 90.9 FM and 103.3 FM. KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Eleven minutes past 8 o'clock. It is Thursday morning, November the 19th. Good morning, everyone. I'm Scott Michlin. Check. November 19th. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air, of course, in San Juan County, 103.3 FM over the air in Durango, Colorado, and streaming everywhere, of course, from our website, worldwide, ksje.com. Welcome also to our visual radio viewers this morning. Welcome to you. We are streaming live today on the KSJE Facebook page, our YouTube channel, and our Twitter account. We're glad that you are with us, everybody, watching this visual radio program. Coming up in the next few moments, my guest here in the studio from San Juan County. We'll be talking about something new, the Mental Wellness Resource Center that is being launched here in San Juan County. We'll talk more about that in the next few moments right here on KSJE, so stay tuned for that. Coming up next hour at 9 a.m., it is our COVID-19 Community Information Program. Megan Collop will be joining me here in Studio A. And this morning, we're talking with Jason Sandell. He is on the Governor's Business Resiliency Committee. We'll be talking with him about some of the latest public health orders and much, much more coming up this morning at 9 a.m. live on YouTube, Facebook, and Twitter. And again, a rebroadcast at 5:06 p.m. on KSJE Radio at 90.9, of course, and on our website. And don't forget about our partner radio station airing the program at noon today. That's KNMI, Vertical Radio at 88.9 FM. Mick Hess will be on the radio at 9 this morning, roving with the arts. And this morning, Mick is featuring some trumpet music, surprise, surprise, from the composer Tillman. You'll hear more of that coming up this morning at 9 a.m. on KSJE Radio. Don't forget, of course, in addition to Facebook, YouTube, and Twitter, you can also connect with us on Instagram if you're an Instagram person, so check us out over there as well. Here's our weather forecast. More nice, mild weather for this time of year. Mostly sunny skies today with a high of 67 in Farmington, a low tonight of 33 degrees. Partly sunny tomorrow, the high 64 on Friday, but maybe a chance of showers developing Friday night with a low of 39, and maybe some more chances for showers on Saturday with a high of 64. Clearing up Saturday night with a low of 29. Partly sunny on Sunday with a high near 60 degrees. Outside right now in Farmington, lots of sunshine, 41 degrees here at San Juan College. And let me introduce my guests who are here with us this morning. From San Juan County, Sue Hodgeman is here. She is the Behavioral Health Director, relatively new department here at San Juan County. Good morning, Sue. It's good to see you. Thanks for coming in.
Thank you. Glad to be here.
You bet. Good to have you here. Also joining us in the studio this morning, Liza Lier is here. She is the Healthcare Healthcare Assistance Program Manager. Good morning. Thank you.
morning.
I can't even read my notes. That's
Thanks.
sad.
No, it's okay. Thank you, Scott.
Thank you. Good to have you
Pleasure to be
back.
here.
Yes,
Yes.
welcome back. And Devin Neeley is also here from San Juan County. Good morning, Devin. Good to have you here, too.
Morning, Scott. Glad to be here. Thank you for your time.
Thank you for coming in as well. It's great to have you all here to talk about this really important development here in the county. And Sue Hodgeman, let me turn back to you about what we're talking about this morning, the Mental Wellness Resource Center, something that is relatively brand new. You are putting this together kind of as we speak, right? But it's ready, almost ready to go.
We're building it as we speak, kind of
Yeah.
like building a jet in midair.
Well,
Yeah.
but it's needed. It's a needed jet.
Yes,
Right?
yes.
To get us where we want to go.
Yes, the county commissioners did what we've been sharing with everybody. They did the behavioral health gap analysis in 2019, and one of the main concerns at the beginning point was that there wasn't a central place for people to go or to call just to find out where the behavioral health, the substance abuse resources were. You know, they could go to one place or another place, but the process was very confusing, especially if you're in crisis.
Right.
And so one of the main recommendations of the behavioral health gap analysis is that there needs to be a central location, and they called it the Human Service Coordinating Center. We've renamed it. We did a poll with the county commissioners and a group of behavioral health providers and some consumers, and they came up with the name Mental Wellness Resource Center. That sounds less intimidating,
Right.
Because it shouldn't be an intimidating process.
Right. And it sounds like what it does.
Yes.
Right,
yes.
which is providing these resources.
We
and
provide
kind of
resources,
a
yes.
one-stop shop, if you will.
Yes.
And so that's what you are putting together. And this gap analysis, I know you and I have talked about that before, which is what got you in this position,
Yay,
right, with
yes.
with the county.
Yes.
And it is something that was local and determined exactly what we need here in San Juan County. And kudos, I think, to the county commission and to
Yes.
you for following through on this, right?
Well, yes, the county commission commissioned that. Oh, I rhyme. And, they did a very thorough research. They talked to a lot of different varied people and providers and consumers and came up with a list of recommendations, I think, in 5 different categories of what needs to happen and various ways to make it happen within the next couple of years to bring San Juan County into a better picture of wellness.
Right. And we're learning more about kind of how our residents are doing when it comes to mental wellness. And so what did that analysis tell you?
It tells us that a lot of people are struggling, and this was before COVID even hit, so we know they're
Right.
struggling even more now. So this is a very timely endeavor because we are able to assist all the providers to coordinate better with each other, to understand who's doing what and where they're doing what's needed, and we'll get better at that in the future. That is our goal, to follow the behavioral health gap analysis. That's our blueprint for wellness for the next several years.
Got it. And then will you do another one, you think? Maybe when that expires?
That would
or
probably make sense
to
do.
have an
Yeah.
updated,
That will be up to
need?
the commissioners,
Okay.
though. Yeah,
Got
because
you.
they're the ones who started this process, and
Sure.
they're keeping an eye on everything.
But there's certainly the one that you've already done gives you a pretty good roadmap, I guess,
Yes,
of where
it
how to
is.
move forward, which is where we are.
It's my blueprint.
Yeah,
Yes.
there you go. Lisa Lier, let me turn to you a little bit about the job that you do and how this impacts and coordinates with this new mental wellness resource center.
Great. So, Scott, Healthcare Assistance Program, as you know, was renamed in 2014 from the Indigent Fund. And it is a dedicated tax that helps people, residents of San Juan County, pay for their medical bills. And so it's a great complement to what is happening with the new Behavioral Health Department and providing for funding to help pay for medical bills, and mental health is certainly a medical bill. And so the Behavioral Health Director is funded out of HCAP monies.
Okay.
And so we're working together on all things mental health and how they relate to physical health, and providing funding and programming and services for individuals in the county.
Right. If they can't pay, you can figure out or try to help them figure out a way to pay for these services. Is that what you're saying?
Exactly.
Got you. Because these services are needed by everybody, right?
Everybody.
It doesn't just affect mental illness, mental problems, mental concerns don't just affect some
Everybody
socioeconomic levels, right? All of them.
Everybody struggles. Everybody struggles. And one of the things we want to do is make it less of a stigma. You know, everybody struggles at one time or another with mental wellness in their life. Everybody does. And so we want to make that more normal and more acceptable so people can reach out and get the assistance that they need, or at least they're not afraid to talk about it. And it's normal, you know. Getting the flu is normal. And having difficult times in your life is normal, and we need to be able to reach out to get those services, to build the skills, to become resilient in times of need, in times of trouble.
Sure, but still a bit of a stigma, right?
Oh,
that you
absolutely.
run into when
Yeah.
we talk about this, and people are like, well, maybe someone else is having a problem, but I'm certainly
No,
okay.
I'm not.
I'm not having a
and
problem.
heaven forbid, you know, if there's any schizophrenia or any of the higher level of mental illness anywhere, because that's scary. It's been demonized forever. I mean, look at Frankenstein.
Right.
Yeah.
That's true.
Yeah.
And Liza Lier, when people come to you again, I mean, the first step would be admitting maybe that they do need help and to reach out. But maybe there's another issue of, gosh, I might need help, but how do I pay for this if I go and get the help that I need, or maybe someone in my family needs? How do we pay for that?
Certainly. So, Scott, part of the process we're formulating with the mental wellness resource is asking those questions in intake. You know, do you have health coverage? If you don't, let's look and see if you qualify for Medicaid or any other program out there. And if not, then HCAP can step in and provide assistance to help pay for those things. And sometimes that's a barrier for people, is not knowing how they're going to pay for services. So folks, you know, medical or mental issues put off the care that they need to get to a place of wellness.
Right. Very good. And Devin Neeley, let me bring you into the conversation because I know you are working on making sure all the other parts of this are available, like websites and phone numbers and things like that, and that is coming into vision right now?
Yeah, correct. We're working to make sure that everybody is aware of this service. You know, the bottom line is sometimes you just need an advocate. You need a little bit of help to find the help that you need. Everybody needs a friendly face and someone that knows the ropes, and that's exactly what the Mental Wellness Resource Center is. So the website is already up. It's going to be a work in progress. We'll have more and more information there as we go. That's online at sjcounty.net/MWRC. Obviously, right now we can't let you in the front door, but if you schedule an appointment to take some time and go down to the Mental Wellness Resource Center, you know, to just come on in.
And that is located where?
That is on Maple at 814 West Maple, right across from the San Juan Regional Medical Center emergency room.
So it's in Farmington.
Correct, in
just
Farmington.
So folks know, yeah.
Just right off of, I believe that's Lake.
Yes.
That comes down and intersects with Maple at the hospital, and you know it's easy to get to, not hard, and we're hoping that people will take advantage of this service, because what this is really just a hand. It's a hand up and a little bit of navigation to a better mental future, really.
Right, very good, and we're showing a picture of the front door, if you will, on the
Yep.
screen right now, so folks can kind of see what the building looks like. But the fact that it's right there by the hospital is probably a great place to be on that almost medical campus now that the hospital has kind of been developing over the years. And again, with the county, that's a great spot for it.
Yeah, we're grateful for the support of the San Juan Regional Medical Center with the use of that facility. They've been very generous, and we'll be working with their providers to make sure that their providers can refer people to the resource center should providers recognize that need in a patient at the hospital, and we'll be working with other local organizations to make sure that that's available as well.
Very good, very good. Sue Hodgeman, let me turn back to you a little bit about the term mental wellness. We hear about mental health and behavioral health and things along that line. So talk to me a little bit about what things mental wellness covers. Is it really all-encompassing?
I think so. Mental wellness covers everything. It covers your daily functioning, your thoughts, your feelings, your well-being. We know that there's so many factors affecting mental wellness. It could be a traumatic event. It could be a genetic event in your family history. It could be, we know that trauma is generational. We now know it's carried through our genetics a lot of times. And or it's situational. It varies it's different with every single person. And so, it covers the use of chemicals like substance abuse, just your daily functioning. If you're in deep, dire poverty, that's going to affect you, and how you were raised as a child, the skills that your parents taught you or didn't teach you. There's just so many varying factors to our mental wellness.
Right. And you mentioned a couple of things that I wanted to ask you and follow up on a little bit about it being generational. Talk to me a little, and genetic. Tell me a little bit about those studies.
I've read several studies that talk about if somebody is raised in a family where there is like dire poverty, it just kind of, and I'm not a scientist, so
Sure.
I can't say, but the genetics.
But you certainly do a lot of reading about this and know a lot about what we're talking about. Sure.
But the genes can form to expect that and lead you into those behaviors that bring it on even more, genetically speaking. Because this is how it is for us, and this is what we expect, and this is what happens. So
this is what I'm used to in my family, so why would I expect anything different?
Because you don't know any different. You don't know. And that's not true with everybody, so I wanted to put a disclaimer on that so nobody's offended, but sometimes that happens.
Right.
Or we've been repressed all of our generations, and so this is what we come to expect, and this is how we live. And it's just, and there's so much research out there. They could disprove everything in the next 10 years, but we work with what we have.
But we see it, don't we? I mean, we see it in our community.
Absolutely.
And so, we might not know the exact cause, but we certainly see the results.
We have historical trauma here. We have generational trauma. We have a high rate of substance abuse. We have a high rate of suicide, and that was even before COVID hit.
Right.
And now it's even higher.
Well, that's the other thing I want to ask you about, too, is now with COVID, I think everybody is certainly stressed.
Yes.
And it may be impacting our mental health and our wellness and all those different things. And it's important that we realize that I think, we're all trudging through, but
not everybody is. Not everybody has the skills.
Well, or trudging as well as we would like to be trudging through,
we're all
I suppose.
trudging, one way or another we are.
Right.
Yeah.
But that's important. And so this can be helpful for everybody.
Yes, we have a quick list. We have a quick list of resources right now that are that have maneuvered around to serve the COVID situation. A lot of the majority of counseling's gone online, which in a way is pretty good. People can call for counseling now. People live 60 miles away from their therapist, but they can call and have a conversation with them now.
Right.
There's so many better and creative ways that we're trying to reach people and give them the opportunity to talk about what's going on and learn those skills of resiliency and survival right now.
Sure. And I hate to bring it always back to the cost of, the cost, but
yes.
But I think that concerns folks too, especially during this time. Maybe in my household, we got one person working now, or maybe they're working reduced hours, and so we can't maybe afford what we normally could afford, or maybe we're not sure if our insurance would cover something like this.
Many people are struggling financially, and your financial situation is your survival. We've
Sure.
That's how we, survive in this world in a lot of ways.
Right.
And so, people are really being stressed financially, and they don't know what to expect the next day, and it's hard to go to sleep at night wondering what's going to happen the next day. And our services are free.
Okay.
I wanted to add that.
Good to know.
Yes.
Well, I think that's a question from our audience this morning about how do we pay for some of these things. And so if I walk in the door, I shouldn't be worried that I'm going to have to write a check.
Right. No, our services are absolutely free. They can make an appointment. They can call and make an appointment, or they can, soon they can access our resource directory online at our website as well. We're working on that. It's a very, very vast resource directory that gives lots of information on how to contact. But if somebody comes in, we walk them through the process. We don't say, you need to go here and here and here. We say, what have you tried before? What's worked? What hasn't worked? What do you think you need? And where have you gone before? How did that work for you? And we give them information, we give them phone numbers, and if they want us to help them make the connections, we do. We don't do the work, but we empower them to make those choices. So when they're successful, they can take credit for it.
I was going to say, that's a big part of this too, isn't it? To empower the individual to take some ownership and
Yes.
some responsibility into getting the help that they're
Yes.
looking for?
Yes, we have peer mentors who've been through the process, who are in recovery on various levels themselves, working one-on-one with people, either on the phone or in person, or on the internet. We can email people as well and give them those resources and walk them through the process. We know sometimes it's very difficult, especially if you're stressed.
Right. Sure. Or just not sure.
Yeah,
Haven't
or
done
you
this
don't know
before.
what your insurance will pay for, that type of thing.
Right. Yes, sir.
If I may, I notice on Facebook there's a
We have a question coming
a
in.
note here that, well, the bottom line is this is not the service. The Mental Wellness Resource Center does not provide counseling. The Mental Wellness Resource Center is a navigator that can help you read the map, that can help you use the compass to find where you're going rather than providing that service. So, sometimes, like I said, this is a crossing guard. This is somebody that helps you get across the street, not necessarily the one that picks you up and takes you there. They help you across the street, help you get the services that you need, and depending on your very specific situation, pay for it, get there, things of that nature. So
It's a good distinction to make.
correct. The service that's provided is navigatory rather than actual mental counseling or services of that nature.
And I guess that also explains that you're not really reinventing the wheel, because we have these professionals in our community,
Right.
and you are just referring folks to those folks who are already doing this type of work in San Juan County.
Our key word is connections. We're making connections. We're helping people make connections to the source of their healing, where
Gotcha.
they need to go, where they want to go.
And Liza Lier, you're here this morning because you do help people pay for some of these things, right? And so your program, again, is more for low, moderate income residents, correct?
Correct. And we also have the capability to help people enroll in Medicaid, and so that's a great thing to have for individuals, because it's more than what we can pay for.
Right. And a lot of folks may not be aware that they do qualify for Medicaid until they come and talk to you, perhaps. I mean, do you find that sometimes?
We do find that sometimes, not so much in recent years, because the providers, the hospital, doctors' offices are doing a really good job of doing that screening a little bit, and many of have provided staff to help their patients enroll in Medicaid, and so not as much as we used to.
I see. And of course, and I know your program, your job changed a bit with the Affordable Care Act, because that certainly covers a lot more people with health care than we used to have covered with health care, no matter how you feel about the politics
Yes.
of it. But
Yes.
I mean, it's indisputable that more folks are covered now under health care. But if
Yes.
they're still falling in between the cracks, that's where you can step in to maybe help.
Yes, totally. And so in 2014, ACA went into effect, created the health insurance exchange, created expanded Medicaid for our state. So more adults were eligible for Medicaid, but there are still some folks that are just slightly above in income and don't qualify, or feel that they aren't able to purchase a program or a policy under the exchange. And so there are mechanisms where we can still help them with an ER visit or things like that.
Gotcha. Very good. My guest this morning from San Juan County, we are talking this morning about the new Mental Wellness Resource Center, which is coming online here from San Juan County, and with some grant funding and other resources that have been able to be pulled together to make this available for all the residents of San Juan County. It is located in Farmington, and Sue Hodgeman is here. She is the county's behavioral health director. And so, Sue, let's talk about what we hope to accomplish by having all these resources available and by getting these folks the help that they need. Obviously, if we have a better mentally healthy community, that's got to help in a lot of different ways. It's got to be a domino effect for better job performance and educational outcomes and all kinds of things, right?
Generally, people will be happier. They'll be higher functioning, like you said, better job success, better educational attainment, happier in their life. Mental wellness sets the tone for everything in your life. All the successes that you want, you have to be mentally well to be able to attain them.
Right. And some of the other things that we hear about, unfortunately, in our community, domestic violence, child abuse, things like that, I would hope that these outcomes would also be improved with
Yes,
better
we have
mental
those
wellness.
resources. We want to destigmatize and take away the fear from if you're in a domestic violence situation, there's no judgment. Stuff happens and you need to get the help. Either if you're the perpetrator or the victim, it doesn't matter. You both need help. And so if we can spend the money on wellness and not spend the money on medical visits or incarcerations, I think generally everybody's happier. You know, if we don't have to pay to keep your child in foster care, and if the child is with you, the child's going to be better, you're going to be happier, child's going to be healthier, then, you know, the tax money can go to other things like recreational things and happy stuff.
Right.
Instead
or,
of...
or pave my road or something
Yeah,
like that.
absolutely.
Devin
Yeah.
Neeley?
We already saw that with the implementation of the JIP, the Joint Intervention
Yes.
Program with
Right.
TMS. There was a six-figure savings through people who weren't being taken to the hospital because they couldn't go to there was no reason to take them to jail, or taken to jail because there was nowhere else for them to go. You know, we're seeing these people treated for their substance abuse problems. We're treating the root of the problem, and rather than throwing money at the consequences of the
Yeah.
problem, the root of the problem is being treated. It's being eradicated, and we're saving money. That's not the only reason to do this. There are people involved that now have their life back. There are families involved that are now back whole together, and that's really what this is all about. Is, you know, we've seen that in our community. It is helpful in our community, and this is just another way that we're
Another step.
moving in that direction.
Right, and I think that's a good point to make about the JIP program, and that has been widely reported and studied, and the outcomes are, you know, you can kind of point to the data and say this is saving, you know, families, human beings, livelihoods, and dollars and cents, and that's part of it. And I would imagine that's probably what got the attention of maybe the county commission and some other folks who are involved with JIP to say, you know, we can be funding it at this end or at this end. And if we do it at the beginning, we may have better outcomes. We will have better outcomes, and there's a lot of data that shows that, right, Sue
Absolutely,
Hodgeman?
Yes. And I just want to reiterate that anybody can call us. Anybody can come in. Right now we're following all the COVID safe practices, so it's better if you call us and make an appointment and call in or access us online. But anybody from mild anxiety to severe schizophrenia, you know, we'll help anybody. Anybody. There's no judgment, there's no levels, there's nothing. Everybody is welcome.
Good to know. And we were talking about this number that folks can call, so
The number
what is the number that they can call?
It is 505-636-7110.
Okay.
And
Repeat
it should
that.
be hooked up tomorrow.
Read that one more time for me.
505-636-7110.
Okay, it's so new.
It's so new.
It's a
My
brand
staff
new
doesn't
number.
even know it
It's
yet.
it was just hatched this morning.
Yes.
That phone number. So
Yes.
there you go. But again, this is brand new stuff that we're talking about.
Yes.
This is going to be unveiled, and again, the resource center that is available right on Maple
Yes.
Street,
Yes.
by Lake in Farmington, and that is the shot of the building there that we're
Our
looking
beautiful
at
sign.
with the beautiful sign and the logo, and so there it is available. And so again, as we wrap up, we just have a couple of minutes remaining this morning, but I think it's important for folks to know that even if they're in, I mean, again, I can't stress it enough. It doesn't matter who you are, what you do.
Doesn't
In
matter.
San Juan County, if you've got a stressful job, there was a note on our Facebook page earlier about maybe some of the folks working at the detention center.
Oh, yeah.
And they're coming up with high stress situations
They
and,
are.
and things along that
We work
line.
closely, we have another program that works closely with the detention center on another grant. We'll talk about that another time, but yes.
Right. But they could take advantage of this
Yes,
too.
anybody can.
Right? And so-
Anybody.
and that's
Anybody.
the point.
Absolutely.
So-
Anybody can take advantage of this, and I hope everybody does.
Very good. Excellent. Devin Neeley, final thoughts about, again, the website is online, and we'll be adding to it here in the next few days and weeks.
That's correct. sjcounty.net/MWRC, and we'll have the phone number up there as soon as I get back to the office.
Okay.
But yeah, we'll be able to have a lot more information up there. And actually, frankly, online there's already a good resource that lists all of the behavioral health service providers in our community. It's somewhat strange, but all of those service providers are in the city of Farmington. There's really not many on the outlying areas, and so you can search that map right now and see. And then once the phone number's up, you can give them a call and see if there's other services that might apply.
Yeah, and we're building that resource directory as we
Correct.
speak and finding more and more, adding more to it all the time.
Very good. Well, and I think it's important to remind folks that even though we live in somewhat of a more rural area, we do have these resources
There is,
locally,
yeah.
and folks need to be aware that they don't have to go 3 hours
Right.
away
Yes.
to find help, maybe right here in the next town over.
And it is expanding. There's a new one in Bloomfield. Of course, there's Navajo Nation and their services that we support and we talk about. I'm sure there's some in Aztec, I believe. So they're out there. We just need to help people know that they're there.
Right, which is what the job that you'll be doing at the Resource
it.
Center, to
Yeah.
navigate them towards those resources that exist. And Liza Lier, final thoughts from you a little bit about the work that you do and to try to help folks to find resources, find a way to pay for some of these medical and healthcare things if they're at lower incomes?
Just feel free to call, and we'll talk you through, help you through determining what you might qualify for. However, we can help.
Very
Please
good.
Call.
And they can call that same number to get to you as well in your
Certainly.
program?
Certainly.
That will work as well. Wonderful. Well, it's a great addition, I think, to our community. And again, the goal to make us all healthier and more productive and better citizens and
happier.
Which is great for this year, especially. So,
Especially.
there you go. Thank you all for coming in this
you.
morning. I really appreciate
Thank
it,
you, Scott.
everybody. It's great to have you here.
Thank you very much.
Thanks for coming.
You bet. Thank you very much, everyone. My guest this morning talking about the new San Juan County Mental Wellness Resource Center on KSJE. Back with more in just a moment, everybody. The time right now is 8:40 a.m. KSJE is supported by the University of Denver Graduate School of Social Work Four Corners program. The program is accepting applications for the Advanced Standing MSW program starting this summer 2021. Students with a bachelor's degree in social work are eligible for the one-year program. Complete an application by January 15th, 2021, and the